Good evening, everyone. So, today we shall, in view of Epilepsy Awareness Month, we shall briefly discuss about the various concepts of childhood epilepsy and its management, and also various kinds, and and also we shall briefly touch upon the home care management of epilepsy. So, as you are well aware, in this brief session, I shall start from the febrile seizures and followed by briefly on infantile epilepsies and childhood epilepsies. So, what is febrile seizures and what is seizure per se? So, seizure is nothing but uncontrolled electrical activity in the brain. And what is epilepsy? Epilepsy is two or more unprovoked seizures occurring 24 hours apart. And what is febrile seizures? Febrile seizures are a type of seizure occurring in children between 6 months to 5 years of age, and it usually occur without any evidence of intracranial infection like meningitis, and without any hypoglycemia, hypocalcemia, or hyponatremia, and without any prior history of unprovoked seizures in the past. So, the febrile seizures is a term usually used in developmentally normal children and occurring with fever. There are certain caveats in this kind of seizures that one must remember. So, the height of temperature is more important rather than the rate of rise of temperature. So, the height of temperature means the peak temperature. The peak temperature of the at the starting of the fever is more important. And also, there are various risk factors for the development of recurrent febrile seizures that one must remember. So, out of which the most important is the duration of fever. So, when the duration of fever is short before the seizure, there is high risk for the recurrence. And also, when the age is less than 18 months, and when the shorter peak of temperature, and also when there is family history of febrile seizures, there is high chance of recurrence of further febrile seizures. So, and also one must remember that these seizures can occur without the fever at the onset, and the fever might develop gradually later after the seizure onset. So, the fever need not be present at the onset of seizure. So, yeah, so then coming to the various types of febrile seizures. One is simple and the second is complex. Simple febrile seizures are nothing but when the seizure lasts less than 10 minutes, and when it is generalized means occurring of both upper limbs and lower limbs, and also in the form of uprolling of eyeballs or twitching of angle of mouth. And it also can occur in a one attack in like one episode per attack over a 1 day period, and then we call a simple febrile seizure. Then coming to the complex, the seizures are rather lasting more than 10 minutes, and it can be focal, means the only clonic movements of only one side of the body, like only involving the one upper limb or one lower limb, and also like Todd's palsy is a complex febrile seizure, and also there can be one or more episodes over a period of 24 hours. Then we call as complex febrile seizure. When coming to the duration of that is 10 minutes, one must remember that the parents are rather very much anxious and panic when they notice the child is seizing, and so they might misinterpret the duration of epilepsy, and they can say it as 15 minutes rather than 10 minutes. So one must be cautious while classifying these seizures because it's important for the further management. So then coming to the etiology. So what causes febrile seizures in children? So children's brain is rather very much vulnerable for these seizures because the brain is very much susceptible for higher temperatures, and also there are certain genes that can predispose to febrile seizures in children, starting from Feb1 to Feb10 genes have been observed, and also it is a autosomal dominant inheritance. So then how do we evaluate and manage these children? So during the evaluation one of simple febrile seizures, there are guidelines proposed, and for these we need not require EEG or MRI. We can, and whereas for complex, there are no specific guidelines, and it will depend on the physician experience and their own perspective. So, like for complex, you can we usually do EEG and MRI, and we also start anti-seizure drugs as and when necessary. So then coming to the management, how do we manage febrile seizures? So first we need to control the fever and control the seizure. So for fever, usually we can prescribe antipyretics like paracetamol or ibuprofen. They usually help in coming down of the temperature. But tepid sponging that we normally do, it is usually contraindicated because it can lead to vasoconstriction and it can further rise the temperature. And also there are various drugs for intermittent prophylaxis that we usually use is that is like clobazam or also called as Frisium. So clobazam prophylaxis is usually given in these seizures to prevent the recurrence of these seizures. Clobazam at a dose of 1 mg per kg per day over a period of 3 days is usually given for these children with febrile seizures to prevent further recurrences. Then how do we do when the child has seizure? So when the child is seizing, we usually advise parents to not to panic, and there is high chance there is further recurrence of episodes, and they need to know how to manage such episodes. So so we should advise them not to panic and not to restrain their hands or their legs, and not to overcrowd the child, and we should properly ventilate. Should be the in the room should be present, and they should not put anything in the mouth to stop these seizures, like putting any his hand or any water. So and also we usually see the parents, they usually keep their keys in the hand, so that won't reduce the recurrence of seizures, and also it won't stop the seizure. And so we usually prescribe midazolam nasal spray when the child is seizing, or also we can use rectal diazepam to stop the seizure. So the midazolam nasal spray is usually prescribed at a dose of like 0.1 ml per puff. You can use one puff, or depending on the weight of the baby, like up to 0.5 mg per kg per dose. And that is like 0.5 mg you can use, or zero point 0.1 ml you can give one puff depending on the weight of the baby. So there are various brands available. So it is not an irritant, and you can just spray it into the nose and lie the baby in the recovery position. So that's usually left lateral position. So this position prevent the aspiration and also help the child to sleep properly. So after spraying of the spray, the child usually lies down and then he wakes up after some time. So it usually helps in stopping of the seizure. For suppose if the seizure does not stop after giving the spray also, then one must consult the nearby hospital or doctor for further management. Rarely they won't stop with the nasal spray. So this is the management of febrile seizures. But for complex seizure, like lasting for 10 minutes, or if it's like focal, one must consult nearest pediatrician, and so that he will evaluate and treat the child. So then coming to the another common topic, that is infantile epilepsies. The most common infantile epilepsy that we see is West syndrome. So in West syndrome, we usually see the characteristic seizure called as salam spells or epileptic spasms. So these spasms usually are missed by the parents when the infant is seizing, and they will think the child is just having some fear. So it usually occurs like a jerky movement of the head or bilateral upper limbs or trunk. So it can involve as head drops also. They usually occur when the child wakes up from the sleep, and it usually occur in clusters like 1 to 10 per minute or even 20 also. So it is usually missed, and the lead time that we commonly say, that is of onset and is of diagnosis, that period, it usually the more the lead time, the more will be the damage to the brain, and it will lead to more development delays. So this West syndrome is a rather deadly disease, and we must treat as soon as we notice such episodes and these events. They usually occur when a child develops hypoxia during the time of birth, or when the child has in hypoglycemia during the early infancy. So that might lead to West syndrome. It can also develop due to certain genes that also can cause West syndrome. And so the management differs compared to normal epilepsy with West syndrome, because in West syndrome we usually use steroids or ACDH or vigabatrin that we normally won't use for further epilepsies. So whenever you find such spasms, please consult pediatric neurologist, and the management will take its own course. Then coming to the one more common epilepsy, that is called as Dravet syndrome. So Dravet syndrome is epilepsy. It's the most severe form of epilepsy that usually follows certain vaccination-induced seizures. So we usually see post DPT vaccination, the child might develop seizures, that is post DPT or post MMR previously. So after vaccination, within 3 days, the child might develop fever along with seizure. So for those seizures also, one must be careful, and one must give paracetamol, and they must consult pediatrician, because gradually it might develop into deadly disease called as Dravet syndrome. So Dravet syndrome also, there are various management that will take course, and they must consult pediatrician. Then the one more most common epilepsy that we see in the childhood, it is called as Rolandic epilepsy. So in Rolandic epilepsy, there are the it usually occurs between 6 to 8 years of life, and the semiology of the seizure usually occur in the form of twitching of one side of the face or angle of mouth, or hypersalivation or drooling, because it usually involves the Rolandic area of the brain that usually supplies the face and oropharynx. And also there might be twitching of eyelid, twitching of mouth. So all these proper semiology in case of Rolandic epilepsy. They usually occur when the child during the night time, and it is rather benign thing, and it usually subsides with treatment. One more benign epilepsy is Penetopolis syndrome. In Penetopolis syndrome also, the symptom is retching and vomiting. It usually occurs during day or night time, and the nausea and retching is usually followed by a period of unconsciousness or paleness, pallor, anemic, and rather they will be unresponsive. So this kind of epilepsy also is rather benign, and it is treatable. And this kind of syndrome is usually misdiagnosed as some encephalopathy and mistreated. So one must be careful to treat such episodes. So also in the epilepsy is not such a malignant thing. It is rather treatable, and so parents must know how to manage these kind of epilepsies in at home, and when to bring the child to a pediatrician. Because several seizures, they for further for simple seizures, they need not consult pediatrician. They can manage at home only with proper knowing of the precautions and the spray, and they can see at home. But for severe epilepsy like West syndrome or Dravet syndrome, they must consult pediatric neurologist. So with this, I conclude my talk, and we can take certain queries if there are so. I'll just see the comments. So yes, there are no comments. So if any queries, you can just contact me in KIMS Cuddles. Thank you.